Ah, the neck crack to show you mean business move. Classic. It's become a common Hollywood trope and the last sound that pretty much every bad guy in a Steven Seagal movie hears. But besides the big screen, spinal manipulation is also a common form of manual therapy treatment, utilized by both chiropractors and orthopedic physical therapists alike. It consists of a controlled quick thrust that is applied to a joint, causing it to stretch and often producing those unmistakable popping sounds. Over the decades, spinal manipulation has earned a controversial reputation, mostly perpetuated by flawed theory and misinformation. In this video, we explain everything you need to know about spinal manipulation. Let's kick this video off by addressing the biggest misconception surrounding spinal manipulation: subluxation theory. The proposed idea that common spinal aches and pains are caused by a shift of joints in the spine. The chiropractic profession was built on this idea, with much of their treatment approach focused on restoring joint position. But as it turns out, subluxation theory has proven to have no scientific foundation to support that spinal joints can just simply slip out of place. Decades of scientific studies investigating this topic have all come to the same conclusion: spinal subluxations do not exist at all, or are so insignificant that they are essentially meaningless. Basically manual therapy's version of Jar Jar Binks. Because if fixing neck or back pain is as simple as just knocking a joint back into place, then people should respond to spinal manipulation in a very predictable manner. But they don't. In fact, only specific subgroups of people appear to have any meaningful improvements with this form of treatment, even when identified as having so-called joint subluxations. And to further put this theory to bed, there is an absence of credible evidence that demonstrates that spinal manipulation has any effect on joint position or movement whatsoever. So not only can providers not detect these subluxations, but they can't even address them. Now, is it possible for spinal joints to sublux or dislocate? Yes, of course, just like any joint in the body. But it would take a significant force to alter joint position that would be clinically meaningful and detectable, like a fall from a height or a car accident or some other form of high-impact trauma. But this is not the type of subluxations that this theory is based on. This theory suggests spinal subluxations can occur with normal daily activities, like, recreating the opening scene of The Lion King with your cat, for example. Normal stuff. And don't get me wrong, joints can be the cause of spinal pain, but not due to these mysterious subluxations that have eluded researchers for years. For one, it falsely depicts the human spine as a fragile structure. Providers who promote this disproven subluxation theory inevitably instill a false sense of vulnerability in their patients, which can cause a fear of movement due to concern that their joints are going to crumble like a Jenga set at any second. While in reality, the spine is an incredibly strong and stable structure that can endure huge loads. But this isn't the worst of it, because this concept has been monetized, with some providers capitalizing on this fear, as they sell an indefinite amount of visits to their patients under the false pretense of fixing spinal subluxations and maintaining alignment. We did an entire video on this concept of alignment, which you can watch by clicking the link at the top right hand of the screen. Now, if subluxation theory is bogus and there is no evidence that spinal manipulation improves joint position or movement, then how does it work? Well, despite the lack of support for the structural mechanisms suggested in spinal subluxation theory, there is definitely something going on, because patients can experience incredible relief after this treatment. Researchers believe it is all about the neural input that this technique provides to the body. The quick thrust that is delivered to a joint appears to set off a complex interaction between the peripheral nervous system and the central nervous system. This results in a cascade of several proposed neurophysiologic effects, including a reduction in muscle reflexogenic responses and central motor neuron excitability, reduced temporal summation, increased neuromuscular control, and activation of the descending pain modulation pathways. Wait, what? In other words, spinal manipulation appears to reduce muscular spasms, enhance muscle control, and decrease pain sensitivity and processing, so you can move more effectively and with more comfort. Interestingly, this treatment appears to be dose-dependent, meaning the effect is influenced by the speed in which the manipulation is delivered, hence the quick thrust during the technique, and less so on the audible pop sound that is heard. Although very satisfying to hear for both the clinician and the patient, there is evidence that suggests the pop is actually not necessary, with studies showing no difference in the effect of manipulation on pain or movement with or without the audible pop. Okay, so we know what spinal manipulation is and have somewhat of an idea as to why it works. But who then should receive this treatment? Well, it really comes down to identifying specific subgroups of patients that are more likely to respond, because the current evidence in support of spinal manipulation is overall quite messy and inconclusive, particularly in studies that look at just general groups of patients with spine pain. And this is attributed to the multifactorial nature of pain, as pain is not only influenced at the site of symptoms, but also by a variety of other physical, psychological, and social factors. For this reason, researchers have begun to look at subgroups of patients to try to weed out those who are more likely to respond to spinal manipulation and those that are not. So it really comes down to the expertise of the provider, utilizing sound clinical reasoning to determine if spinal manipulation is not only safe, but also appropriate for each individual patient. In other words, just because you can crack someone's joints, it doesn't mean it's needed or even necessary. There is moderate to high quality evidence to support the use of spinal manipulation in both acute and chronic stages of back and neck pain to improve pain and disability, but only for the short term. This is because the effect of spinal manipulation is transient, with studies showing minimal impact of pain or disability in the long term, especially in chronic spine conditions. There is also no quality evidence showing any benefit of maintenance spinal manipulations. At this point, you may be asking yourself, but why then do I go for monthly adjustments if there is no evidence to support doing so? Well, good question, and a discussion you should have with your provider. Despite the clear lack of long-term improvement with spinal manipulation, this treatment does have value. No, it's not to realign or put anything back into place, but instead, it can provide a critical window of opportunity for providers to get people moving more comfortably and more often, with reduced pain and improved control. This allows for greater participation in more active modes of treatment, such as strength and endurance training, modes that do have long-term benefits to health and well-being. Because there is research suggesting that adding spinal manipulation in combination with an exercise program results in a quicker return to prior level of function compared to exercise alone in those with neck and back pain. To recap, the controversies surrounding spinal manipulation are mostly undeserved, and likely due to being tied to the hokey subluxation theory for so long. Admittedly, there is still a lot we don't understand about the effects of spinal manipulation, but there is clear short-term benefits for certain types of spine conditions. Although temporary, the burst of novel sensory input that spinal manipulation provides can be exactly what the body needs to kick it into gear. But once it gets going, it's important that movement is promoted with a consistent exercise program, especially in chronic pain cases, in order to see long-term improvements. So unless you're going to take on an active means of managing your pain, save yourself the money and cancel that monthly adjustment, because like Jar Jar Binks, it's essentially pointless. Thanks for watching another episode of PhysioShow. Make sure you like and subscribe to the channel to receive more physical therapy related content.